Hi, my name is Leann DaWalt. I'm a senior scientist at the Leann Center at the University of Wisconsin-Madison. I am a 40-something white female with um, light brown hair that's pretty long, and I am wearing a black sweater today. I will be talking to you about our project on co-occurring health conditions of individuals with profound autism, findings from electronic health records. As some background, individuals with profound autism increasingly have been excluded from research, and thus little is known about the health of individuals with profound autism, particularly during adulthood. Research is needed that is inclusive of all individuals on the autism spectrum. The current study addressed this gap by comparing health conditions of autistic individuals who meet the criteria of profound autism. Here we define this as IQ of 50 or below, and we compare them to autistic individuals who do not meet this criteria. We further compare differences between males and females. For the current study, data were drawn from electronic health records from the Marshfield Health System. Adults with at least 2 ICD-9 codes for autism were identified from the larger electronic health record, and for us to know that they were autistic adults. These cases of autistic adults were then classified into those having profound autism, so codes of IQ below 50, versus not having profound autism, so no code signifying an IQ below 50. This resulted in our final sample of 347 adults with profound autism. 104 were female, and 1,791 autistic adults diagnosed with autism, but who did not meet the criteria for profound autism, and this included 356 females. Next, we considered the health conditions that were in the electronic health record. So we focused on 7 categories of health conditions: cardiovascular disease, endocrine disease, gastrointestinal disorders, neurological diseases, nutrition conditions, psychiatric conditions, and sleep disorders. Prevalence of health conditions was defined as having at least 2 ICD-9 codes in a disease category. And healthcare utilization was defined as the number of healthcare encounters within a category. And this is where it was for the autistic individuals who had a particular health condition. And we conducted a 2-by-2 analysis of variance for each domain, where we were able to compare autistic adults with profound autism versus other autistic adults. We were able to compare males versus females, and the interaction of the profound autism status by sex. To summarize our findings, over 50% of autistic adults experience neurological conditions, psychiatric conditions, gastrointestinal disorders, and nutrition conditions, in addition to many of the other conditions we studied. Adults who have profound autism have significantly greater prevalence of these health conditions and more healthcare utilization than other autistic adults. Adults with profound autism had a greater prevalence and a greater healthcare utilization in the areas of gastrointestinal conditions and neurological conditions compared to other autistic adults. There also were significant interaction effects, wherein women with profound autism were the group who were at highest risk for endocrine conditions, and also were particularly high risk for high levels of healthcare utilization for psychiatric and sleep conditions. For cardiovascular disease, adults with profound autism had a higher prevalence than other autistic adults, but there was no difference in healthcare utilization between the 2 groups for those who had cardiovascular disease. So in conclusion, we find that individuals with profound autism have significant health vulnerabilities, even when compared to other autistic adults. Unlike most past research, this study did not rely on samples of convenience, but rather used population-based real-world data. And we discovered actionable healthcare insights. We see that screening and intervention for these various health conditions are needed for autistic individuals. For example, particularly for females with profound autism, action is needed in the areas of endocrine disease, psychiatric conditions, and sleep disorders. We would like to thank all of our funders and particularly the Marshall Clinic Research Foundation for their partnership and support. Thank you very much.